Try to do 4 blocks of 40 time. It's a good indication. If you can do a NBME, which is 200 questions, and you don't feel exhausted, that's a good sign. Yeah? Yeah, cool. All right, ladies and gentlemen, are you ready for GI? Now, I am all about quality over quantity. I'm not going to sit here and do 30 questions in an hour because it's not going to help any of you. I'm here now today to interact with you, to show you my techniques, to answer your questions. And then you have access to the QBank videos. You can watch it at your leisure, where I go into deep detail, because my theory, which is correct and it's been proven because people pass under my guidance, is if I do one question, and let's say cardiogenic shock, and I look at all the answers, I will learn hypovolemic, neurogenic, septic, obstructive. I will learn them all, because why not? If I only learned one, I'm leaving the other ones for later. Later will never happen because you get too overwhelmed with information. So overall, one question will yield 5 answers. I push you hard. So for every question you do with me, you learn most of the answer choices anyway. You build your basic science foundation, and also you learn more information to help you eliminate answers. If you guys are not aware of this already, you will not walk into USMLE Step 1 exam being confident enough to knock out every answer, to get every answer correct. You will have to depend on your knowledge to eliminate answers. The way that works is just like in the hospital in real life. You have a patient you see, you have 9 differentials. You're not going to always get the diagnosis. That's very stressful. You have to know enough about the other differentials to knock them out one by one. And eventually, doctor, I hope you walk in to answer every question right away. But if you don't, because you're stressed, you're tired, you're exhausted, it's too complicated, it's too long of a scenario, it's worded differently, you might be in trouble. If you have the backup of, hey, well, I don't have the answer, but I can knock out most of these answer choices because I know enough of these answer choices provided to me, then you feel a lot better. Yes, yes, yes. Awesome. Good. So let's begin. You guys are going to hate me for this, but you guys will love me later. Check this out. Ready? Hold on, hold on. There we go. So are you guys aware? Do you guys know about the surface antigens, anti-surface antibodies, hepatitis B? I hope you do. I love doing this scenario because many of you, I could say myself, were not tested or were not shown how to learn this in class. So I do it, and I take it upon myself to teach you guys what I can when I can. And I do these a lot in my QBank videos because I need you guys to know this, right? So typically in AMBOSS, there's a section in the study plan that has all questions like this. They're tabled questions, right? Many of us, including myself, would panic when I see this. I just panic. And I'm like, I don't want to do it. I don't know what's going on. But it becomes kind of easy if you practice. Yes, yes. So I will, before read the scenario, I will show you what I would do. I always attack the columns first. I'm like, okay, there's a lot of columns here, but I have surface antigen, anti-surface antibody, E antigen, anti-E, IgM, IgG. Okay, question for you all. Surface antigen, what does that really mean? What does that really mean? Because if you don't know what it means, how can you answer any question, right? You can't answer this question if you know what it means. So think about what surface antigen means to you. To me, it means as an active infection. It's simple. There's a surface antigen, right? The person's sick. Okay, active disease, active infection. Fair? Fair. Good to go so far, right? Yes. Anti-surface antibody. Please answer me this in the chat here. I have the chat, which I will put a smiley face on. Hold on. Here you go. My smile to you. I want you guys to think, what does this mean? Anti-surface antibody. Think about it. You could put in the chat. What does that mean to you, right? What that means to me is, well, it's either that the person was infected and resolved, like they cured themselves, right? Meaning they recovered, versus B, they have been given the vaccine. So it's either they were infected and now they're okay, versus given the vaccine. Fair? Fair. Okay, nice. So surface antigen, sick. Anti-surface antibody, oh, you either were sick and now you're okay, or someone gave you the vaccine. All right. E, hepatitis B, E antigen. E for transmissibility, infectivity. Yes. Ladies and gentlemen, if you don't know what these mean, I don't blame you. I mean, I didn't know them either as a med student. You know, in class, they would have a PowerPoint presentation. Teacher would teach it for a couple of seconds and move. Then you ask them, can you explain it to me? Yeah, nah, it's okay. If a doctor can't explain this to you, they just don't know what it is. Just heads up, they don't know how to explain it. So I'm going to show you, because this covers a lot in hepatitis and also microbiology and actually just hepatology in general, right? So surface antigen, infected, anti-surface antibody, sick, recovered versus a vaccine. E, transmissibility, effectivity, not good. It's very bad, meaning you're very sick. Anti is the opposite, all right? You don't have the transmissibility. All right, guys, IgG, IgM, which is acute, which is chronic? Tell me the acute, tell me chronic. Which is acute? Which is chronic infection or chronic? When does one show up? A few weeks versus a few months. Samuel comes in with IgM. Yeah, of course. Either you understand why, I'll make it easier for you. G looks like a C. So under stressful times, stressful events, if you're block number 5, 6 on your test day, you're tired, you're exhausted, you're hungry, people are typing away in the Prometric Center, you're like, man, I don't remember. Which is IgM? Is it freaking acute or chronic? G looks like a C, chronic, done, out. That's the easy way. If you know one is one, the other is the other. If you want to go the other side, A, it looks like an M. M looks like a capital A, right? That has a little peak over here. So I make it easy for me. I see G. G looks like a C. C is chronic. So G is chronic. A is acute. M is acute. Fair. Now we'll read the scenario. And I hope you realize columns like this, tables are very easy because you don't have to hit every particular column. You always go to the one that you know most and you go from there. And eventually it exposes to you the answer choice that's correct, okay? I will read the scenario and I will show you how I attack it and hopefully it resonates with you all. So, lab studies show ALT, AST, 1917. Is it high or low? Well, less than 40 is normal. So it's not high, which means it's less than 40, okay? So these are okay. Hepatitis B DNA is detected, but the load indicates a very low infectivity. Stop. What do we know right away? We know that this individual says hepatitis B DNA is detected, and the load indicates very low infectivity. Infectivity is what? Infectivity is E. E is transmissibility, infectivity. Is it positive or negative? Negative, guys. Is it positive or negative? Infectivity, positive, negative. Negative. It says low chance. All right, so we go negative, 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 negative. By default, if this is negative, this has to be positive. So we go positive and positive. So far, so good.